and it was an honour to present to the Backbench Committee with my right honourable friend, the member for Newcastle-upon-Tyne East. The repercussions of this pandemic will have a significant impact on children and young people. And the mental health charity Mind has said that COVID will leave a deep and lasting scar on the mental health of millions. And the statistics are grim, some of them have already been cited. And in March, my committee heard from the Royal College of Psychiatrists a massive rise in children self-harming, with a 7% rise in girls aged 11 to 16 since 2017. In 2019 to 20, the number of children being referred to mental health treatment soared by 60%. And we all see these awful statistics in our constituency. I had a mother in Harlow come to me and say that her otherwise healthy child, since lockdown, not being able to school, had started compulsively washing her hands until they were raw and bleeding. So are our children getting the help that they need? The Children's Commissioner suggested that the number of children accessing the treatment they need increased by just 4%. And I believe there are ways we can turn the tide. Let's rocket boost the government proposals to put mental health professionals, but in every school and quicker than the current plans. The What Works Centre for Wellbeing has identified that good mental health and wellbeing at age 14 to 15 has a significant impact on educational attainment at age 18. The Department for Education show that pupils with better emotional well-being at the age of 7 were more than one term ahead of pupils with poorer emotional well-being. I've seen the impact of organisations like Place to Be in schools in Harlow, like Stewart School, who benefit from their services. And Madam Deputy Speaker, it's not just about the provision of mental health, it's also about prevention and resilience. And last week I visited a remarkable school, Newham Collegiate Sixth Form, where I met with students and the head teacher, who described the resilience and preventative work they do. They employ a coach to work with students to develop techniques to conquer their anxieties. School assemblies are utilised to teach schools needed to manage highly pressurised environments, using examples by sporting personalities. In private study periods, desks are set up to resemble exam halls to help pupils become familiar with the setting. And these are the kind of arsenals that we need, that should be replicated in schools around the country. But the second element of prevention must be by considering to extend the school day for extracurriculum activities. I welcome the £5 billion government catch-up, but it should also be about extracurricular, because we know that young people who participate in school clubs, after school clubs, are 20% less likely to suffer from a mental health disorder. The Education Policy Institute found that a longer school day increases educational attainment by 2 to 3 months, and the Department for Culture, Media and Sports found that extended school day can boost numeracy skills by 29%. So why not on earth will the department not at least pilot proper experiments on extended school days in some disadvantaged areas in the country, using civil society, providing those extracurricular activities, so we can really see the difference they make and then make that case to the Treasury. Head teachers, like the head at Newham, would love to be able to offer extracurriculars to their extracurricular activities to their students, just as the private schools do, but they just don't have the funding to do this. Now, the Local Government Association estimates that the annual cost of mental health problems in England is around £119 billion. By rolling out counselling services to all state-funded secondary schools, that would cost £100 million per annum. This would provide access to a school counsellor for at least 2 days a week for more than 90% of schools. So it makes economic sense to invest in prevention, given we know that most mental health problems emerge before the age of 25. Finally, we know that social media, which is damaging all of us, but particularly young people, is a wrecking ball for young people's mental health and well-being. Research from the Education Policy Institute and the Prince's Trust found the damage that social media is doing to teenagers' mental health. Bernardo's have found that 79% of Bernardo's practitioners reported children between the ages of 10 and 15 have accessed unsuitable or harmful content. 1 in 3 girls said they were unhappy with their personal appearance by the age of 14. So the links are clear. social media providers should not be allowed to duck their responsibilities, and I'd urge the Children's Minister to work with the Treasury to introduce a mental health levy for social media giants so they can take responsibility for what is happening to our young children. Ofcom published a report earlier this year which stated the revenue for social media companies is 4.8 billion. Introducing a 2% levy could create a funding pot of around £100 million. This could be distributed to schools to provide mental health support and digital skills training for our young people to build the resilience and online safety skills they need. And because the social media companies know they would have to pay this levy, they may perhaps at last behave more responsibly towards our young people. To conclude, Madam Deputy Speaker, social media firms and tech giants must do more when much of this problem is caused by the very apps and the platforms they have built. We must rapidly deliver the commitments in the Mental Health Green Paper to ensure that a mental health professional is based in every school, and sooner rather than later. And prioritisation should be given to initiatives that support prevention and teach resilience, as I highlighted with the example of Newham Collegiate Sixth Form College. Now, only by doing so can we deal with this epidemic and ensure that our children and young people emerge from the pandemic both resilient and able to climb the education ladder of opportunity.